Hi everyone. In this video, we'll talk about the EHR module of Elixir. And we'll start here on the patient lookup screen where you can filter by different statuses. You can search, you can filter by admit date or filter by level of care, primary physician, things like that. We'll go ahead and we will search for a patient, and that'll quickly filter down this list where you can then open the patient chart. Here we'll do a quick tour of the interface. So across the top we have our tabs here where you may have medical orders for capturing vitals, entering lab orders, sending out prescriptions. Then we have our notes and forms. You can schedule appointments, you can create care plans, you can use Message Center to communicate with the patients in the portal, enter some problems and diagnosis, create orders if you want to order equipment, and then some shortcuts to the billing and post-care items here. Then on the left, we have the summary card. That's just kind of a quick capture of some of the patient demographic information. And then across the middle, we have everything that they've entered when they registered, some family history, social history, things like that. Then we have our care episodes, which are like encounters, related contacts, which they may be anyone that's associated to that patient, whether it's their doctor, a sibling, parents, a child, anything like that, you would track here. And then any of the problems and diagnosis that you've captured, you can see a summary of those here, as well as any of the medical examinations, and then any notes or attachments that you've uploaded onto the chart itself. So talking about the patient journey, you may want to send out an intake assessment. And this is sort of a form bundle that can be sent out. So it would be multiple forms that they fill out in succession online through a secure link. And then it would push that back into the EHR under the notes and forms section. So you would just click send intake assessment, and this would be sent out and emailed to the patient using the email address on file. Then once they've submitted the forms, you may want to schedule an appointment. So we'll go up to appointments here. And we see we have an existing appointment here. And we have our action buttons where you could check them in or cancel the appointment. We'll go ahead and create a new appointment. We'll filter this list of practitioners and we'll select one of them to see their availability. Now you can switch to different appointment types that may have different work schedules. And so you just pick an available time slot and then confirm the appointment. Here on the review screen, you can attach a room resource if you wanted to book this appointment to a specific room, and then it can't be double booked. You can schedule it as a Zoom meeting, so when the invite gets sent out, it includes that link to all the attendees. And then we would go ahead and schedule that appointment. Now your appointment is confirmed, and now it will show up on your calendar. Now let's take a look at some of the notes and form templates. So those can be found under the Notes tab here. And all of your existing forms and notes are listed here. We'll go ahead and create a new note, and we'll start a SOAP note template. Now within this SOAP note, you can expose these components from Elixir, such as the problems and diagnosis, within the note itself. So you don't have to navigate away. So we can add existing problems or create new problems. We'll add an existing problem here, and you can select multiples, and those will pull in those existing problems with the history of the notes on them, and you can update for this current session, and those would then be stored directly in this note so you can see what was discussed during this visit. Similarly, you can add allergies or medications from those components, and then any of these fields that if you've captured information, say on an intake form, you can then pull that data over and auto-populate into this form as well. You're able to capture vitals if you want to track that in here. And then the diagnosis is similar to the problems list where you can add existing or select new. You'll just select that from the list, and then you can add the new notes for this session. Then towards the bottom here, we have procedures. So if you want to add billable procedures, we can expose that component in there as well. And then you would go ahead and save that form. Now we'll take a look at another template here. As an intake form, these can be exposed on the patient portal, so someone can complete them online and then submit into back into Elixir. So if they've already completed it, the form is pre-populated and the information can just be updated if there's a next visit. They don't have to refill everything on the form. And these have dynamic fields, so depending on what answers you select, it exposes fields where you can elaborate further. So then as they fill this out, they can then sign off on it and submit it to the provider, and that would be pushed back into Elixir for you to review. So that is about all for the notes and forms there. Now I'll take a look at how to place a lab order. So that can be found under the medical orders tab here, and then we'll select lab orders. And then we'll go ahead and select new order. We'll select the lab that we want to send to, the ordering physician, who entered this, who verified, and then the facility. And then you have your different tests here that you can select and add to this list here. Select any diagnosis. And you can save and transmit this directly to the lab, or you can just save it and have someone transmit it later. And then you'll see all of your entered labs here. Anything that's been transmitted, once the results come back from the lab, this download button will light up blue, and you're able to download the report directly from the lab. You can also open up the lab and see any results within that record. Next, we'll look at how to place a prescription order. So we'll go to the medical orders tab and then select prescriptions, and then we'll click new. And then you can do a drug search here. You can also add any allergies. You can see all the active medications and previous medications. We'll go ahead and search for a medication here. And then we'll select one of these doses. And here you can select the quantity, the form, the route, all of these options, and then any refills that might be required. And then you can associate a diagnosis, and then we can go ahead and prescribe. Next, it'll have your list of pharmacies, and so you go ahead and select one of those and hit transmit. That will send it off to the pharmacy to be picked up. I hope you've enjoyed this brief overview of Elixir EHR, and I'll see you in the next video.